Patient education is very important when it comes to dental implants, restorative options, because people, first of all, they want to know what's going on. They want to know what's going on with their teeth. They want to know what their options are. And one thing that I find very odd is that a lot of patients that come to our office that maybe have been in other places, they have never seen what their options are. The one thing that we really want to get through to the patient is I want them to see what it would look like for them. The challenges that commonly are faced with traditional dentures for patients is lack of suction, lack of being able to chew or eat the foods that they want, to bite into an apple, to eat corn on the cob. Yes, there are a few that can do that, but not every denture is the same. In fact, most have a problem with that. You lose 75% of your chewing efficiency when you go from your teeth to a traditional denture. Food doesn't taste the same anymore because your roof of the mouth is covered with the denture. And then of course your tongue, which is a constant moving muscle, keeps moving those dentures around, especially the bottom denture. That is why a lot of patients choose to go to an implant supported route, just so that they can avoid all the pitfalls. What makes our all-on-4 or all-on-6 or even a fixed bridge, which are interchangeable for the same thing, stand out compared to other options is the fact that you lose the least amount of chewing efficiency out of all the options. You lose 75% of that efficiency when you're going to a full denture. You gain another 25% if you're going to a removable implant supported denture. But with a all-on-4 or all-on-6 fixed bridge, you regain 75 to 80% of what you had when you had your natural teeth. And what we like to take the approach is to really over-engineer it. We like to put as many implants as we can, and as the jaw allows, to really plan for a good, stable, long-term solution. The way we customize dental implants and the final result so that we make sure that it looks natural for each patient is, number one, we look at the patient as a whole. We like to see pictures of them, what they looked like before. We like to talk to them and see what they like to get out of their smile, how bright, how much teeth showing. We have different sized teeth that we look at. We really try to get into the head of the patient, not to assume what they want, but to get what they've always dreamed of. If you're hesitant about taking that first step in improving your smile, I have to tell you that I understand. It's scary to get into an office where you don't know the people, you don't know the cost, you don't know what the procedure will entail. We have numerous patients that have anxiety, numerous patients that were nervous, numerous patients that had to cross that barrier and find the courage to do it, and none of them have regretted it. What I can tell you is that we're on your side. What I can tell you is that we're not going to cut corners. And what I can also tell you is that you're going to have the smile that you've always dreamed of. So make your appointment, call our office.